Welcome everybody, with you Dr. Magdi Abdelrazik, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about negative results of HIV test. So we have to know that HIV is a virus that attacks cells in the immune system. When it is not treated, the virus can seriously weaken the immune system over time. Several types of tests are available to determine whether someone has an HIV. Testing is important both in preventing HIV and in helping people who have contracted the virus to seek treatment. A person is said to be an HIV negative when a test does not detect HIV. However, a negative result does not necessarily mean that they do not have an HIV. Also, we have to know that HIV negative, these people receiving negative results from an HIV test means that the test did not detect HIV. However, a negative result does not always mean that a person has not contracted an HIV. This is because each type of HIV test has a different window period. A test window period is amount of time that passes between exposure to HIV and when a test can accurately detect that a person has contracted HIV. If a person is tested within test window period, the test may not be able to detect the presence of the virus and they may have a negative result. When negative result is received within a test window period, it is important to get another test after that window period has passed. This can help to confirm the negative result. Additionally, HIV exposure is possible during window period. In this situation, HIV testing may not be accurate. So, what are the main types of HIV tests? There are 3 different types of HIV tests, including number 1, antibody tests, and number 2, antigen antibody tests. Number 3, nucleic acid tests. So, as regard the number 1, antibody tests, an antibody test looks for the presence of antibodies to HIV in a sample of blood or saliva. Antibodies are specialized proteins made by the immune system in response to disease-causing agents like HIV. Many HIV rapid or self-tests are antibody tests. Results can be available in 30 minutes or less, depending on the type of the test. The window period of antibody tests is broad. It can take anywhere between 23 days to 90 days after a potential exposure for antibody test to accurately detect an HIV infection. As regard antigen antibody tests, this test detects antibodies to HIV as well as specific viral proteins. This is called antigen B24. Typically, a blood sample from a vein in the arm is used for this test. However, there are some rapid tests available that use blood sample from finger prick. How long it takes to get results can depend on the type of test. If a sample is sent to a laboratory, it can take several days to get results. Results from rapid antigen antibody test can be available in 30 minutes or less. Because B24 can be found before antibodies to HIV are made, antigen antibody test may detect an HIV infection earlier than an antibody. The window period for standard antigen antibodies test is from 18 days to 45 days. Rapid antigen antibody tests may take longer, between 18 days and 90 days. So as regards the nucleic acid test, it looks for the presence of the virus genetic material in blood sample. A NAT can detect HIV in a person's blood anywhere between 10 days and 33 days after a potential exposure. However, while these tests are more sensitive, they are also expensive and are not typically used for screening. Blood samples for NAT are sent away to laboratory for processing. Because of this, it can take several days to receive test results. NATs are also used after HIV diagnosis to detect the amount of virus in person's blood. This is called a viral load test. As regards what are the HIV tests? HIV is one of the two types of HIV. It is the most common type of HIV worldwide. In fact, it is not estimated that about 95% of people currently living with HIV have HIV 1, type 1. Because HIV type 1 is so prevalent, most HIV tests are geared toward detecting HIV 1. This includes all three types of tests that we have discussed above. So, what are HIV tests? Type 2. It is less common than HIV type 1. It is estimated to make less than 0.1% of HIV diagnosis in the United States. On a genetic level, HIV2 is over 55% different from HIV1. This means that many types of HIV tests may not be able to accurately detect HIV type 2. As regards if this test come back positive, a second antibody test is then ordered to determine if person has HIV 1 or HIV 2. If test results are indeterminate, a NAT is done to either confirm or exclude diagnosis of HIV type 1. Thank you very much.